Hi, my name is Dr. Luisa Kimali. I'm a psychologist and director of the Emotional Health CBT Clinic. I'm talking tonight about social anxiety. I've already, in part one, covered what is social anxiety. In part two, covered what are some of the thoughts that maintain social anxiety and how we can change those. And now I'm moving on to the behaviors. So what are some of the behaviors that are getting in the way in social anxiety? As is the case with all anxiety, avoidance is a big one, a big cause of maintenance of the anxiety. So we want to avoid avoidance. And avoidance can take many shapes. So it might be avoiding the party altogether. It might be going to the party, but staying in the kitchen with the cat. It might be talking with people, but yet, being about meanwhile, you're evaluating yourself and thinking about what the person thinks of you, what you look like, what you're going to say next, all those things, and just not being in the moment, not being with the person, fully engaged in there. And avoidance maintains fear in two main ways. I mean, the two, do interact, but for sake of clarity, I've separated them this way. Also because it leads to slightly different tools. So in a way, when you avoid, you don't find out that your predictions are incorrect. So all of those catastrophic scenarios that, if I gave a talk, I would fumble and not be able to talk, and my mind would go blank. I just, wouldn't be able to do it. If I went to the party, I wouldn't be able to talk to anyone. I'd be sitting in the corner. People would think I'm weird. If I asked someone out, they would of course say no. So, there's all these negative predictions, and you never get to find out that actually it could be a positive outcome. So it's really about, finding out. It's, if you start a conversation with a perfect stranger, what happens? Is your prediction accurate that it won't go anywhere and that it won't be pleasant and that you'll feel weird and that you will not know what to say next, and the whole scenario? So avoidance maintains anxiety by not disconfirming your thoughts, and the way around that is to run experiments. And another way that avoidance maintains anxiety is that you don't learn that the physiological response that you have, that sustains that fear, doesn't stay forever. It really goes away after a little while. And so, you've built that association between these social situations and anxiety, and now you see the social, situation, or you think about it and it elicits the anxiety, and you predict that the anxiety would always be there. And by not exposing yourself, you don't find out that that's not true. And the way to break that association, and the way to learn that you can have that physiological reaction and it goes away, is through what we call desensitization. So how can you prepare yourself to do these things? Because facing what you fear or what makes you anxious can be difficult. And so you need to, really feel prepared and motivated and wanting to do it. So you can prepare with motivation. So I'd encourage you to really write out what you would do if you weren't socially anxious, all of the good things, how it would benefit you, how it would be pleasant, how different your life would be, what are the things you want to do. So really start from that. Then develop skills in relaxation. So deep breathing, muscle relaxation, mindfulness. Those are all important because especially if you have a big physiological reaction, it makes it more difficult to think, right? Like if you feel like your heart is pumping, like it's coming out of your chest, and if you feel like you can't breathe and you're feeling so dizzy and all of that, it's really difficult to say, I'm going to focus on the situation. I'm going to, because it's calling for your attention. So being able to bring it down a notch with deep breathing, relaxation, mindfulness is definitely going to help you. It's something that you can use, before you go to the party or before your presentation, to just like, okay, I'm gonna just, relax my muscles, breathe a little bit slower, with the intent of really facing, really being engaged in the situation. Like you're not using it as an avoidance. You don't want to be in the situation and say, okay, I'm breathing, as opposed to being there. But it's more like allowing you to be fully present. You want to have maybe some positive coping statements. In the previous section, we looked at some of the thoughts that maintain social anxiety. And so, and some of the reframes. And so you might want to make a list of the reframes and, the ones that are specifically going to be helpful to you. And give yourself compassion, encouragement, being kind to yourself. You can read about social skills if you think that it's going to be helpful, sort of as a refresher, just to give you like some hints. But usually people with social anxiety, it's really an anxiety disorder. It's not as much a lack of skill, but again, it might be that you're just, like less practiced and confident. But what I would warn you though, is to not then see it as a performance. Stay away from, I've got to develop these skills and I'm going to evaluate myself on how I'm using the skills. And then it becomes about skills. In the end, a good social interaction is really one where you're truly interested in the person in front of you and you're really engaged with them and you're really in the moment. You want to know more about them, and then you're able to relate, so you can disclose a little bit about yourself, and you're being kind, receptive, expressive. Like it's not so much about skills as much as that basic interest, and presence probably being the biggest piece. You can visualize yourself, how it's going to go well, or realistically, that you're going to go there, you're going to feel a little bit anxious, but it's okay. You're going to focus on the people that are there, and just practice in imagination, including your posture, and just to try to live it as much as possible. That's really, good practice is as close as what the situation will actually be. You can also choose a role for yourself, but as long as it's not something fake, like you're not trying to be someone that you're not going to be the social butterfly, moving from person to person that you're not. But by role, we mean more like in the service of. So, finding your place, and so maybe on this committee or in this meeting, you're an advocate for something, and that's what you're doing there. It might be that your role at the parties, you're going to make people feel comfortable and have a good time, and obviously then that translates into you. but that can be your role, and that might be a difference. Maybe you feel comfortable when you're hosting a party at home because you have a role. You're making sure, and it's not being yourself, but it's more like you want to make sure everyone has everything they need, that they're having a good time, introducing people, and that makes it easier. But there's no reason why you couldn't do that when you go to a party. So sometimes that can be a way to make it easier as well. So when we talk about experiments, we're really talking about testing out the predictions, the negative predictions. about, different situations, things that you would do. So think of what you would do if you weren't socially anxious, and then think of why you're not doing it. So what is the prediction? If you were to do it, what would happen? And usually it's a negative thing, because otherwise you'd be doing it if you thought it was a positive thing that would happen. So make your prediction and then design an experiment that will test it. But the experiment has to be fair, though. You have to be open-minded that you had your negative prediction based on social anxiety, but then there's other predictions, other ways that it could work. And then have an open mind and go in it fully, prepared to carry it out well. So if your experiment is about starting a conversation with a stranger, well, you have to be willing, though, to look at the person in the eyes. Because yes, if you look at the floor and you start up a conversation, it's in fact, your negative prediction is probably going to come true. So it has to be, well done with an open mind and curiosity and willingness to accept the outcome. I'll give you a few examples. So it might be that, if I say something stupid, stupid, or replace stupid with any other pejorative word, people will react critically. So you could do all sorts of things, right? Like you could stand in front of a street sign and ask someone, where is this street? While you're standing, just in front of it. If the server at the restaurant says, enjoy your meal, you could say, you too. And just see what happens. Another one is if you are particularly concerned with the physical symptoms of anxiety and you think that, it's obvious to people, and, then run to the meeting and see if you get any comments, or hyperventilate on purpose before. So you'll induce some of the symptoms and again, see what the difference is. Like what the reaction or the outcome. You can, another experiment, like something that maybe you would do if you didn't feel socially anxious, is ask a colleague to go for lunch instead of eating lunch alone in your office. Your prediction is that the person would say no. So run the experiment. Again, you want to do it well, though, so it's not sort of this vague, we should grab a lunch one day, but more, like, hey, what are you doing on a Wednesday for lunch? Do you want to try this new restaurant that opened up across the street? So this kind of thing, and then you see what the outcome is. So experiments can be done with anything where you think the outcome, where you fear that there would be a negative outcome, and then do it on purpose and see. So, things like spilling coffee, wearing your shirt inside out, calling the wrong person. And really what will happen is that you will find out that nothing very catastrophic happens. It's more your own feeling of embarrassment, but in terms of actual objective consequences, there's usually not very much. So, and that's the key. The key word really here is objective, because your inner critic, especially if if you've had social anxiety for a long time and a tendency to be very self-critical, your inner critic will say, well, they didn't say anything because they were too shy, but they really thought this, or, it will come up with ways of making it seem like the negative outcome that you predicted did happen. So it's important that it be objective. You have an objective test, an objective result. And the second component is desensitization, which is really what we call exposure, like repeated exposure. And what happens if you've watched my other talks on other topics, that's always there. Whenever there's anxiety, the answer, one of the answers, is always desensitization. So it's exposure to whatever it is that you fear. Yes, the anxiety goes up, especially the first time. So the first time that you would face what you fear, it's the curve that you see here on the graph at the top. So your anxiety goes up and then it goes down over time. And then what you see with the other curves is repetition. And so you see that the second time you do it, the anxiety doesn't get quite as high and it goes back down to baseline quicker, and so forth, until at some point you're able to be in the situation and you're perfectly fine. And it's, you know, the thought that came to mind with regards to social anxiety is that at least with presentations, it's an unfortunate thing that, you know, when people have presentations for just like 2 to 5 minutes, let's say, because you only have the time to build up the anxiety. If you have, you know, a good amount of social anxiety, you can only build the anxiety up, and then you leave the situation. So in your mind, it's, you know, what you learn from it is, this was terrible. For, you know, 5 minutes, my heart was beating fast. I couldn't breathe. I looked like a total fool. It was a horrible experience. That's really how I felt. And imagine if I had had to do it for an hour, just how terrible that would have been. You don't get to find out that actually, if you present for an hour, the first 5 minutes might be, at least if you're not used to presenting, the first 5 minutes might be difficult. And then after that, you're fine. By the, you know, the last, at least the last 20 minutes, half an hour, your body's not producing this anxiety anymore, like this anxiety response. So you end up being in front of the audience perfectly comfortable, which is really a wonderful feeling. And then it helps your confidence, and it helps you the next time around to know, okay, so I'm going to feel really uncomfortable at the beginning, and then it's going to go away, and then I'll be fine. And then you build your confidence, and with repetition, at some point, you're able to just do it. The response is not as high because, you know, the fear has gone down. You've learned that the situation is nowhere near as bad as you know, initially thought about it. And that's really how it works. And it works for, you know, any fear. I mean, you just keep exposing yourself to it, and the anxiety goes away because it becomes just, you know, normal. I mean, you learn that the anxiety can only last so long. It doesn't last forever. And you learn that you can be in the situation and be relaxed and enjoy it. Like you're breaking that association between the two. And what you can do is build a hierarchy for exposure. So you're not, you know, right off the bat going to your like worst fear. You're building it up. So let's say that your goal is to give a presentation at work and answer questions. Well, you can start with giving the presentation when no one's there. Just, you know, hearing your voice will probably be strange enough for the first step. Then you could videotape and you could watch it. You could give the presentation next with, you know, just one or two colleagues. And then, you know, within the group, you could say, okay, I'm gonna now just ask a question. Just, you know, to sort of get that experience of having everybody looking at me. And, you know, asking a question is not as threatening, if you will, as or as scary probably in your hierarchy as answering the question. So keep asking questions until you're okay with having everyone look at you while you're asking the question. Then next step, you know, a question comes up and go and answer it. And then you can maybe give a part of the presentation. It doesn't have to be all or none. You can, have answer some of the questions. Like there's always ways of gradually moving towards your goal. So, and you'll see that, what seems really, really difficult at the beginning when you're making your hierarchy, like the 10 on 10, it just seems so far away. But you'll see that as you go through these smaller steps, then those things appear less and less difficult, and they are less and less difficult. Finally, since we're talking about the treatment, there are medication that can be helpful. So it really depends. First of all, you would need to speak to a doctor or psychiatrist, because as psychologists, we don't prescribe medication. It's not our expertise. But the little bit that I can say, though, is if you have social anxiety that's really global, like across the board, that really interferes with your everyday life, like everything is difficult for you because of it, you might want to consider SSRI or NSRI. So it's, those are the medication that you take every day for anxiety. So those can help. If it's more of a situation where you're a performing artist as a hobby, but you've worked so hard for the recital or for something, and you don't want your social anxiety to interfere, but yet it's difficult to desensitize yourself because you're only getting like 3 minutes twice a year. Then you might want to consider benzodiazepines or beta blockers, because what they will do is reduce quite significantly the physiological response of anxiety that you would have. And so then it gives you a chance to, perform without having to deal with that. And also, build your confidence, because then you have a good experience. And at some point you might say, you know what, I don't even need to take it, because I'm now used to performing and it going well, and I know that I can do it. So it can also be sort of as a step towards. The only thing I would say is, if you do get a prescription, like try it before, just to make sure you don't have a negative reaction to it, and that what to expect. The same, if it's something very you're stressed about interviews, but again, it's something very punctual, you might not punctual, but something more rare, and you're not necessarily wanting to work on it as much, you could consider one of those medications. So anyway, it's something to consider, but social anxiety is quite responsive to cognitive behavior therapy, because as you will have seen, especially in the second part, but also in this section, it's really a lot about the thoughts and challenging those both directly and through behaviors. And it's about exposure. So those are the real, the things that will probably help be most helpful. So as a summary, you want to replace your negative thoughts, like reframe them, give yourself compassion, be specific, challenge those thoughts of, I'll totally mess up and everybody will think, and all of that kind of language, because okay, you express your opinion and one person might disagree and not like your opinion. That might be fine, as opposed to, you express your opinion, everybody will just think poorly of you. And also be specific in your exposure and in your experiment. So if you're going to a party, you don't want to say, I'm going to be confident. It's very abstract. Like, I'm going to talk to 3 people. That's what I'm going to do. And it's important because also, if you make it vague, like, I'm going to give a good impression, I'm going to, it's going to flow. Your inner critic will have a lot to say about that. You open yourself up to your own criticism. But if you say, I'm going to speak to 3 people at the party, you could say, yep, I did it successfully. And that's really how progress is made. And really, if you remember from the first section, social anxiety becomes a problem, like in social anxiety disorder, let's say, when it gets in the way, when there are things that you would do that you're not doing, or you're doing them with great distress because of social anxiety. So it's really about behavior. It's about being able to do what you want to do. So ultimately, it might be about being a non-socially anxious introvert, if that's the case, where you enjoy your alone time and you enjoy your solitude, but you also enjoy people, even, and different situations. The social anxiety does not get in the way of having a rich life within the boundaries that you want. You're not limited. And I'll leave you with this quote that I found really cute from the book that I was speaking about, that the wallflowers and shrinking violets among us are a necessary and beautiful part of this bouquet of humanity. It's really just that we're all different, and there's nothing wrong with being more of an introvert. And if you are struggling with social anxiety, I hope that you really learn some good tools and that you will be using them moving forward. And that's the book that I thought was really, really good, on social anxiety, written by a psychologist who herself had some social anxiety, and very practical, very human. So, and I'm not sure, like, in terms of the effect of the pandemic on social anxiety, it might have, in some way, provided more opportunity for avoidance, which is not good. But at the same time, it does give opportunity for the opposite, right? It gives opportunity to really connect with people. I think people really need it now. I mean, they always do, but I think in this context, potentially even more. Like, if you are socially anxious, this is actually a good time to reach out to people, make that effort to call and email and text and have connections, even if it's in video. So it's a great time, really, as any, to practice. So thank you very much for having joined me, and I will be available tomorrow evening during the question period that goes with the talk, or you can always email me if you have any question, suggestion, comment. Thank you very much.